Krista. I'm going to be your dental hygienist today. It's a pleasure. I've been going over your chart and I've got the room all set up for you when you're ready. Okay, just have a seat right where you are. We're going to be doing a cleaning on you. I'm going to get some x-rays. I'm going to take a close look at your gums. And we're also going to do some in-office bleaching. Alright? That's good. We'll go ahead and get started then. Okay? I'm going to get my gloves on. And while I'm doing that, why don't you tell me if you're having any sensitivity or any problems? Oh, okay. Which area is bothering you? Alright. Okay. Okay, well what we'll do is we're going to get a set of bite wings, which are just to look for cavities between the teeth. And then we'll also get an additional periapical, or PA, which is going to get the root of the area that's bothering you. So I can take a look for any abscess or anything funny going on under the surface, alright? Okay. Alright. First thing I'll do is to put on this lead apron. Get really comfortable here. And that's going to protect you from the x-ray. You're doing great. Now, I'm going to put this little tab right on the side. Open up for me. And bite down. Great. And here we go. Line that up. You're doing good. And now we're going to get one on the other side. Open up. And bite down for me. Good. Okay. Good job. Now open up. Alright, and now for the area that's giving you trouble, I want you to very gently bite down on this tab. If it gives you any pain or any problems, you just open up and we'll try something new. Okay? Open for me. And gently bite down on that. Okay, you did great. Was that bothering you when you bit down on that last one? Okay, good. That's what I want to hear. Have you had any sensitivity to hot or cold with that tooth? Okay. What about the pressure? Alright. Okay, well, when that x-ray comes out of the processor, we will definitely take a look at that. Okay? Now this is Sarah. She's coming into the room to help me to look at your gums. I'm going to make some measurements, and Sarah's going to write down the measurements that I tell her, okay? I'm going to use my Explorer, which is this little tool here, and I'm going to measure the gums around each tooth. I'm going to call out a little number, and my assistant's going to write that number down for me. And what I'm doing is I'm measuring the millimeters of any pockets or spaces around your teeth, and that's going to give me a better idea if you're headed toward gingivitis or a later stage periodontal disease. Okay? Okay. Are we ready? You just relax and open wide for me. Okay? This won't hurt one bit, I promise. Okay. 2, 2, 2, 2, 2, 3, 3, 2, 2, 2, 2, 4, 3, 3, 2, 2, 2, 2, 2, 3, 2, 2, 2, 2, 3, 3, 2. You need to swallow. Okay, go ahead and swallow. You ready? 3, 3, 3, 4, 3, 3, 3, 2, 2, 2, 2, 2, 2, 1, 2, 2, 2, 2, 2, 2, 4, 4, 3, 2. Okay, let me get on the upper over here. We're going to work from the inside. You doing okay? Okay. 2, 2, 2, 4, 3, 2, 2, 3, 2, 2, 2, 2, 2, 2, 2, 2, 4, 3, 3, 2, 2, 2, 2, 3, 3, 3, 3, 3, 3, 2, 2, 3, 2, 2, 2, 2. Okay, you did just great. Do you need to rinse or anything? Okay, we'll just go ahead and swallow. You did great on that. Now, I was looking over your paperwork. I noticed that you wrote that you're having some problems with your jaw popping. Okay, does it ever lock up or get stuck in an open position? Okay, what about any gravelly feelings in your jaw right there? Sometimes you feel like maybe you can feel a grit or gravelly. Yeah. Okay, what about the popping? Oh, okay, well, I'm going to check and feel your temporomandibular joint, which is known as the TMJ. And sometimes it can give you problems and cause some of the things we just talked about. So I'm going to try to just feel and see if I can see anything going on there, alright? Okay, just open wide. Let's see. Okay, now close for me. Alright, open again. Okay, side. Close for me. And open up. Okay, close again. I feel it pop just a little bit over here. Open up. Okay. I do feel like you may be grinding your teeth at night a little bit. Could have to do with that joint, so my suggestion is that we make you a night guard appliance. It's just a little disc that you're going to wear just like a bleaching tray, and you'll wear it at night, and it's going to keep you from grinding your teeth together while you sleep, which can also cause headaches and other problems besides just your joint. Okay, so before we get started, I'm going to go ahead and get that out of the way. I'm just going to mix up some alginate and pressure material, then I'm going to load it into a tray, and then we'll put it in your mouth. You bite down and hold, and it's going to harden. And it's just kind of similar to the way we did your bleaching trays, but it's a little bit different material, okay? Alright. Let's get ready for that. I'm going to go ahead and get this mixed up. Okay. Now I need you to open up wide for me. There we go. And I'm going to hold that there. You just relax and breathe through your nose. Do the best you can to use your nose to breathe. You're doing great. We just have to hold that there for a minute. I know you've done this before with your bleaching tray, so you're doing a good job. Okay, now I just want you to release, open up really wide. Let's get this out, and there we go. We've got it. Okay, that made a really good impression. I think that one's gonna work. Sometimes we have to redo them, but that one did great. So now we're gonna move on to your cleaning. I know that you know the routine, but just to remind you, I'm going to use my scaler here just for any tartar or any kind of buildup I see, and use my mirror to retract while we do it. I'm also going to put some cotton rolls, pieces of cotton in your mouth, just to help me keep a good clean work area. Alright? Here we go. Okay. Now, open wide for me. That's great. You tell me if you have any discomfort or any problems, okay? We can stop whenever we need to. Okay? Doing a great job. Need to swallow? Okay. Your teeth look really well. Looks like you've got some pretty good hygiene. Your teeth look really good. I do see a little bit of calculus buildup, but nothing horrible. Okay, I've got all the calculus off now. It's time for me to go ahead and polish your teeth, and I want to give you a choice of the Prophylaxis Paste. We've got grape, strawberry, or mint. Okay, that's my choice too. Alright, here we go. Alright. Now that I've got your teeth all polished up, you can go ahead and spit if you need to. Now, we are going to work on your in-office bleaching. and I'm going to explain to you a little bit how the process goes. What I'm going to do is retract your lips back with some cotton. Excuse me, I'm going to use some cotton rolls and some other things to retract your lips so that I have a nice dry working environment. We want to make sure that your teeth stay as dry as possible through the whole process. And then I'm going to apply this. It's called Luma Bright. It's 33% peroxide bleach. And I'm going to apply it one tooth at a time. And then I'm going to spray it a little water. And we're going to rinse it off. I'm also going to use some cotton gauze to take it off the tooth so that you don't end up accidentally swallowing any of it. And when you go home, your teeth will be noticeably whiter, but the full effect of the bleach won't take effect probably for 1 or 2 days. I'm also going to send home an at-home bleaching kit, and I'll give you instructions on how to use that before you leave here today. Alright? Okay, easy enough. Let's get started then. I also forgot to mention one little part. I'm going to touch your tooth with a little curing light after each tooth to help that bleach set into the tooth. It activates the whole process. Alright, now the first thing, I'm going to floss between each tooth just to make sure I've got a nice clean area. Alright, we've got that done. You look really relaxed now. Nothing wrong with that. Okay, now that I've got you open wide, I go ahead and put this cotton in here, and let's put some on this side as well. Good. Keep open. I can give you this bite block here. Open up. There we go. That bite block is going to help you stay open wide without straining your jaw at all. Alright? Alright. Start with this first tooth here, and I am applying the gel. Good job. Okay. Tooth. And we don't do every tooth, we just do the teeth in your smile line. Those are the only ones that need the bleaching. There wouldn't be much sense in bleaching those molars. blank cured, I'm going to go ahead and spritz the water on your teeth. And I'm going to wipe off all of that bleach with my gauze. Are you comfortable? Okay. Alright. Now let's clean off all your teeth. Nice and clean. Great job. Okay, now that wasn't hard, was it? Okay. Now that we've got all that done, your cleaning and your bleach, and even your charting, I'd like to go over some things with you if you don't mind. I think that there are some home steps that I think you could really benefit from today. So I want to talk to you about possibly purchasing a Sonicare. Now you may have seen Sonicare before because it's pretty popular. You can find them in stores and they are kind of pricey, but we can offer them here in the office for a discount. Okay, this one, it's our mid-range. We have one that's on the lower end, and then we have one that's really expensive, and then we have this one, which is the middle range product. This one is a really great professional grade product. I still recommend it. I like it just as well as the really expensive one. It's got 5 brushing modes on it. I'll show you what it looks like, okay? Here we go. Sorry about that. It's got clean, gum care, refresh, sensitive, and a massage mode for massaging your gums, or if you have sensitive teeth. Then of course there's the clean mode, just for when you want to brush every day. And let me grab this stuff for you. This is the charger and the stand that it comes with, okay? You're going to put the appliance right on the stand like so, and it charges. You can also see that there's a little door here that opens, and the door holds 2 different heads. One's a larger head and one's a smaller head, okay? So a family member can take the head, and you can buy interchangeable toothbrush heads to use with your appliance. So when these run out, you can just run out and buy a really inexpensive brush head, okay? And this just goes right up on your counter in your bathroom. And there's also a travel charger for when you go out of town or just need a travel charger for some reason. If you and your family members are going to split up and one of you needs to take the charger, this particular model comes with the charger. Now let's say that your significant other has a different model, but you two both have a toothbrush with your each individual toothbrush heads. One of you could take the travel and one of you could take the regular charger. So that's very convenient, especially for couples that both have the toothbrush, the Sonicare toothbrush. Alright? Okay. And I wanted to show you some things since I did your cleaning, and I did notice a few pockets around your gums while we were doing the charting. I want you to start using some things for me, okay? I have put the regular floss in the bag, which is right here. This is the regular everyday floss. And then I also went ahead and put some of these Floss Picks. I know you've probably seen these before, but with these there's really no excuse not to floss. This makes it really easy to floss, okay? It's got a little handle on it, and with a U shape, and then it's a tiny piece of floss in the center. So you can floss just like that, right in between your teeth, okay? These are really easy to use, and I think that they will help you and keep your gums healthier. And I've also added a special rinse that I want you to use. It's a Chlorhexidine rinse. It's called Paradex. It doesn't taste great, but don't follow it with water because that will only make the taste worse. It's best to rinse with it after you brush. It's a great rinse for gum disease or even early stage gum disease, gingivitis. This is great for that. It kills all of those germs and bacteria that cause gingivitis. And this is a prescription only mouthwash. You can't buy it over the counter. So I'm going to send some home with you today and send you a script for it. Alright. And then also, I need to show you how to use your bleaching trays. Okay, this is your bleach, and you know about, I showed you earlier how I put it on your teeth and how to use it, right? So you know all about how to use it already. But when you take it home, these are your bleaching trays. These are the little models of your mouth that we made on your last visit. And these are your trays. And the way you're going to do it is take a tray, and then you're going to open one of these syringes, and you're going to put a tiny amount of bleach in each little compartment on the front, just the teeth that show in your smile line, okay? Absolutely. And then you'll just put it in, upper and lower at the same time, 30 minutes in the morning and 30 minutes in the evening before bed. And then you take it out and you rinse and brush your teeth, okay? And after each use of this, you need to get out any of the excess bleach and make sure you lay it on a towel to air dry. Because if you leave any of the bleach in there, it will get stuck and sometimes harden, and it can affect the fit of your bleaching stick. It was really a pleasure meeting you, okay? Now you take care of yourself at home, okay? When I see you again in 6 months, I hope those gums are looking a lot better, alright? Okay, you have a great day now. Bye-bye.